Hi, my name is Brandy Williams, and I'll be doing my second soap plan on the rotator cuff. So S means subjective. The subject is a 20-year-old Caucasian female college tennis athlete. She practices Monday through Friday, 90 minutes a day. She came in with a complaint of pain in her left shoulder. Pain has been experienced for 3 days. Athlete thinks the injury started during a game when she performed a serve. Medical history. She has no medical conditions. She has no medications. She is allergic to nuts, and she did have a sprained ankle 2 weeks ago. The objective. Her vitals were slightly high. Her blood pressure was 130/90. Her heart rate was 80 beats per minute. Her temperature was 99.7 Fahrenheit. Her physical examination showed no obvious dislocations or disfigurations to the left shoulder. The patient showed pain sensitivity in the shoulder when asked to lift the arm above the head. The shoulder muscle showed weakness, especially when lifting the arm. There were also popping and clicking sounds when the shoulder was moved. The athlete said she was having trouble sleeping at night because of the pain. Radiology. The athlete was given an ultrasound and an MRI. Scans showed 2 of the 4 tendons that formed the rotator cuff were torn. So assessment. The patient was diagnosed with a torn rotator cuff. I believe the injury occurred during the game. She played 3 days ago. She is experiencing limited motor function and muscle weakness of the left shoulder. The injury is most likely occurred because of repetitive arm and shoulder movements. So the goal is for the athlete is to be able to play tennis again without any pain or discomfort in the left shoulder. The treatment will be resting, medication, and physical therapy. The athlete should be able to use the forehand with little to no pain while playing tennis. So the plan. The athlete will rest to help the shoulder heal. The arm will be placed in a sling for 6 weeks. She will take anti-inflammatory and pain medications, and she will also ice the shoulder for 6 weeks. However, the athlete will stop taking medications when there is little to no pain. She will receive corticosteroid injections to help reduce the pain and inflammation, and injections of platelet-rich plasma to promote healing during the 6 weeks of resting. After the 6 weeks of resting, the athlete will get another MRI. If the scan shows that the rotator cuff is healing well, she can start physical therapy. The physical therapy will start off light with stretching, and then we'll move into resistant stretching and then other skills to build and strengthen the shoulder muscles. She will do physical therapy for 6 weeks, and after 6 weeks of physical therapy, she will start doing her tennis practice routines. We will continue to work together until she has full mobility of her shoulder and able to serve and play without pain. And that is the reference.